the effects of exercise on mental health. So 3 questions just to get us started. How many of you struggle or know someone that struggles with anxiety or depression? For those of you that answered yes, how many of you still struggle to cope with these conditions? And how many of you have ever experienced overtraining? If so, what kind of symptoms did you experience and how did that affect your mood? So what is depression? Depression is classified as a mood disorder, which brings feelings of sadness or dejection. This usually results in a decrease of appetite and difficulty sleeping and often inactivity. So whether that's not wanting to get out of bed or just not wanting to do your regular exercise routine, inactivity is going to mean different things to different people. Difficulties thinking and concentrating, whether that be just generally or troubles focusing in school or at work. Oftentimes, depression is treated through medication, and depression commonly goes undiagnosed. So whether that's not wanting to go seek medical attention or just not knowing that you actually do struggle with depression. Did you know that in 2015, approximately 3 million teenagers aged 12 through 17 had at least one major depressive episode throughout that given year? So exercise and depression. Studies have shown exercise has been known to show similarities to standard forms of psychotherapy. For healthy individuals, exercise may be used as means of prevention. So if you do not struggle with depression, just getting regular exercise can help delay symptoms of depression, whereas it may serve as a form of treatment for those with mild forms of emotional illness. So once you are diagnosed with depression, or even if you aren't, it has been shown that just regular exercise can help suppress some of those symptoms. Long-term exercise programs have shown to aid in recovery and treatment of depression. So this is a chart on the long-term impact of exercise versus medication on depression. So as you can see, exercise is on the far left, and it has a 90% recovery rate, whereas medication only has about a 70% recovery rate, and the combination of both exercise and medication have an 80% recovery rate. So, which even a combination of both, a lot of people think medication is the answer, but as you can see, exercise on its own actually does more than the both combined. Okay, so now to deal with anxiety. What is anxiety? Anxiety is classified as a nervous disorder. It is characterized by an excessive feeling of uneasiness and apprehension. This typically results in compulsive behavior and panic attacks. So there's a few different types of anxiety. So generalized anxiety is chronic and excessive, and it's a long-lasting type of disorder. So this is more commonly diagnosed. And then we have what's called panic disorder, which is also in relation to anxiety. So these are commonly referred to as panic attacks. So this is a brief and sudden attack of anxiety. So this usually lasts about 10 minutes, and tends to peak at 10 minutes. That being said, this could be less than 10 minutes, but it's not commonly seen to last longer than 10 minutes. If it does, it's usually another episode. So you're usually suffering from more than one panic attack. Just another fact, anxiety does affect balance. So people who experience severe levels of anxiety, so this is more so seen with people who suffer chronically, so this is people who repeatedly suffer anxiety attacks, they often have troubles balancing. So it's common for them to feel dizzy and sway while standing. So this often starts in childhood, as it's harder to diagnose children with anxiety disorder. So this is often harder to treat. Exercise and anxiety. So studies have shown reduction in symptoms with people with both anxiety and situational phobias. Exercise actually helps reduce the onset of symptoms of anxiety. So just getting regular exercise has been shown to suppress these symptoms. So a lot of people do tend to go for runs just to actually delay the onset of an anxiety attack. It has been shown that simply 20 to 40 minutes of aerobic activity has shown improvements that last for several hours. This is found in patients with both normal levels and elevated levels of anxiety. So this just describes the difference between everyday anxiety and actual anxiety disorder. So just to list a few, we'll start with everyday anxiety. So that would be worrying about paying bills or landing a job, embarrassing or self-conscious behavior just on your own or in a group, and a realistic fear of dangerous objects. So actual anxiety disorder is a constant worry that causes significant distress and interferes with daily life. So that's something that's interfering and you're unable to live life normally because you're in a state of constant worry. So you're also avoiding situations for fear of being judged, embarrassed, or humiliated. So the main difference between the two is actual anxiety disorders disrupting regular life. You're unable to live normally or how you would like to just because you are constantly in a state of worry. You're constantly affected by the anxiety. So can exercise be negative to our mental health? So I have described some of the benefits, but exercise can also be negative. So what tends to happen is we become over-dependent on exercise, and we rely on exercise to be that coping mechanism. So this can lead to obsessive behavior, which can lead to overtraining. Overtraining can lead to mood disturbance and a general decline in overall health. So a lot of individuals will become obsessed with their training programs. So we'll see individuals training 8 to 10 hours a day, not knowing the effects. It's actually, in the moment it seems positive because you do feel good. It's the release of endorphins that makes you feel good, but it's actually a decline in your overall health that you will see if you do it for prolonged periods of time. Extreme overtraining can lead to something called staleness syndrome. It's a condition which entails deteriorating performance and behavioral disturbances, which include clinical depression. So that's basically just saying if you do continue to overtrain, you will start to see a decline in your performance, whether that's not progressing or losing a dramatic amount of weight in a short period of time, and just not knowing why, you could actually be overtraining. So it's important that we do find balance. So to conclude, kind of wrap up what I was talking about, you do want to find that balance between exercise and just balance in general, because we don't want to become overtrained and too dependent on exercise. You want exercise to be there as something to help you cope, but you don't want to become too dependent on it. So to conclude, when we are able to find a healthy balance and avoid overtraining, we will see optimal benefit and improvement in those with illnesses such as anxiety and depression. So that's just a list of a few. I'm not saying exercise doesn't help with more than just these conditions, but these are just two that I found the most interesting in which exercise aids in. So when we maintain a balance, it's possible that exercise can be a preventative method for those who don't suffer. So for those who have never been diagnosed, regular exercise can just help prevent any symptoms of depression or anxiety. And for those that do suffer with mild forms of anxiety and depression, this can actually help serve as a form of treatment. So that being said, ideally, we would eventually like to see more emphasis on exercise-based treatments and less reliance on medications. Whether that's starting off with a balance of both and slowly weaning off the medication, or just kind of starting to treat it with exercise and seeing if that alone works for you.